welcome to the deep dive. For the longest time, I feel like medicine has been a lot like trying to fix a really delicate Swiss watch with a sledgehammer.
Oh, that's a good way to put it.
Right. Because you take a pill to lower your blood pressure, but then it makes you dizzy. Or you take something for a headache, and it absolutely wrecks your stomach lining.
Exactly. And patients have just, kind of accepted that.
Yeah, it's this constant frustrating trade-off. Because traditional chemical drugs just kind of wash over your entire circulatory system, and they hit absolutely everything in their path.
Right, because they're broad-spectrum interventions, so they circulate everywhere, even, and sometimes especially, where they aren't actually needed. For decades, the medical community, and patients too, have just accepted those systemic side effects as, well, the inevitable cost of doing business with modern medicine.
But what if, instead of that sledgehammer, you had a perfectly cut master key? Like something that slides into exactly one lock on exactly one specific type of cell, turns the mechanism, and just leaves the rest of the biological house completely untouched.
That shift from those blunt instruments to extreme microscopic precision, that is the exact promise that is upending healthcare right now.
And that is our mission today. We're going to unpack this entire space for you because we are jumping into a topic that spans from massive mainstream medical breakthroughs all the way to, the bleeding edge of the biohacking Wild West.
It really is the Wild West out there right now.
It really is. We're exploring the exploding multi-billion-dollar world of peptide therapeutics. And to guide you through it, we've got a massive stack of intelligence in front of us.
A very diverse stack, too.
Yeah. Rather than just reading you a list of facts, we've synthesized an FDA regulatory update from April 2026, fresh National Center for Health Statistics data, legal insight reports on telehealth crackdowns, and even a global market report on the $1.3 trillion longevity sector.
Which includes some wild clinical marketing material from a Beverly Hills wellness center.
Oh, yeah, about a highly controversial brain peptide, which we will definitely get to later. But first, to navigate this vast landscape, we need to define the architecture of a peptide. What actually are these things?
Right. So simply put, peptides are just short chains of amino acids.
Okay.
You can think of them as smaller, more agile cousins of proteins, essentially. And because they are smaller and very precisely folded, they can act on very specific molecular targets in the body, like your master key analogy.
Got it.
But the core tension we are looking at today, the real drama, is the clash between their unprecedented clinical success, this massive consumer demand, and the desperate struggle of regulators to, keep patients safe from copycats and unproven claims.
Okay, let's unpack this. Because to truly grasp the hype around peptides, we have to start with the undisputed giants in the room.
The GLP-1s.
Exactly, the GLP-1 receptor agonists. These are the weight loss and diabetes drugs you have heard absolutely everyone talking about, from the nightly news to your family gatherings.
They are undeniably the tip of the spear for this entire industry. I mean, looking at the August 2025 NCHS data brief, the numbers are just staggering. We are witnessing a fundamental shift in the demographics of medicine.
How big of a shift are we talking?
Well, over 26.5% of adults with diagnosed diabetes in the United States now use a GLP-1 injectable.
Wait, over a quarter of the diagnosed population?
Yes.
That is wild penetration for a relatively new class of drugs.
It is. And looking at the specific breakdowns in the source data, it's not evenly distributed either. The peak usage is actually among 50 to 64-year-olds, sitting at 33.3%.
Wow. So literally 1 in 3 people in that age bracket with diabetes is on this medication.
Right. Which makes profound physiological sense, honestly.
Because of the overlapping health issues.
Exactly. That specific age group often presents with compound metabolic challenges. So insulin resistance, climbing body weight, cardiovascular strain, and those are the exact interconnected systems these drugs target.
Right.
But what's equally fascinating is the demographic disparity in the data. So the highest usage is among Hispanic adults at 31.3%, closely followed by Black non-Hispanic adults at 26.5%, and white non-Hispanic adults at 26.2%.
Okay, so all hovering around that quarter to a third mark.
Right. But then you look at Asian non-Hispanic adults, and the usage plummets to just 12.1%.
Wow, that is a massive gap in utilization.
Yeah.
And, to understand why these drugs are so universally sought after by the other groups, we have to look at the mechanism.
Right, how they actually work.
Yeah. I like to think of a GLP-1 as a biological master switch. When you flip this one switch, it simultaneously tells the pancreas to secrete insulin. It tells the stomach to physically slow down digestion so you feel full longer.
Which is huge for weight loss.
Exactly. And it travels up to the hypothalamus in the brain to actually shut down appetite cravings at the neurological level. It's hitting multiple systems with one master key.
And to take that a step further, the GLP-1 hormone naturally occurs in your body anyway. Like when you eat, your gut releases it to manage the incoming food.
Oh, really?
Yeah, but natural GLP-1 is destroyed by enzymes in your body in a matter of minutes. It's very fleeting. The brilliance of these synthetic peptide therapeutics is that their amino acid chains have been slightly altered to resist those enzymes. So instead of lasting 3 minutes, the synthetic peptide lasts a week.
So you are basically artificially extending that feeling of post-meal fullness and blood sugar control for 7 straight days.
Precisely. And that multi-system targeting really explains the strong correlation with body mass index in the NCHS data.
What did the data show there?
GLP-1 use was 32.4% among those with obesity, compared to just 16.7% for those at a healthy weight. So the drugs are clearly addressing the interconnected nature of diabetes and obesity simultaneously.
And they're becoming deeply entrenched alongside traditional medications, right? I mean, the data shows that among adults with diagnosed diabetes who already take insulin, 31.3% of them are also using a GLP-1.
Yeah, they aren't just tossing out their old drugs.
Right. They are stacking this new peptide technology on top of them for better control.
And if we connect this to the bigger picture, the financial scale of this biological master switch is almost hard to comprehend.
I can only imagine.
According to the market research report, the global peptide therapeutics market was valued at $46.4 billion in 2024.
46 billion.
Right. But it is expected to hit $100 billion by 2034, and Novo Nordisk alone held a 17% market share in 2024.
But that projected $100 billion market size collided with a physical reality, didn't it? Like, the massive pharmaceutical manufacturers simply couldn't produce enough of these delicate peptides to meet this staggering demand.
No, they couldn't. It was a massive supply chain failure.
And when a commercial drug supply chain breaks down on a national level, a massive controversial legal loophole opens up.
Yes. The national shortages created just a perfect storm for the compounding pharmacy industry. To understand how this works, we have to look at the regulatory framework. So under Sections 503A and 503B of the Food, Drug, and Cosmetic Act, when an FDA-approved drug is officially placed on the shortage list, compounding pharmacies are legally allowed to make what the FDA calls essentially copies of it.
Just to meet desperate patient demand.
Exactly. It acts as a safety valve for the healthcare system.
Which on its face makes total sense. Like if patients rely on a drug to manage a serious condition and the big pharma companies' manufacturing plants are totally backordered, you want local specialized pharmacies to step in and brew up a temporary supply.
The intention is sound, but the timeline shift changed everything.
How so?
Well, the FDA officially declared the shortage of tirzepatide resolved in late 2024 and semaglutide resolved in early 2025. And once those commercial drugs come off the official shortage list, that regulatory safety valve immediately closes.
Done.
Compounders are no longer legally permitted to mass-produce copies of those commercially available drugs.
Okay, so if the shortage is officially over, why are these massive telehealth companies still pushing cheap GLP-1 ads all over my social media feeds? They must be scrambling because suddenly their legal cover is completely gone.
Oh, they are scrambling, and the regulatory hammer is finally coming down because the consumer demand didn't just vanish when the shortage ended.
Right. People still want the cheaper version.
Exactly. And these telehealth companies had already built massive, highly lucrative business models around selling compounded versions. So the legal reality is finally catching up to the market.
And the FDA stepped in.
They did. In March 2026, the FDA cracked down aggressively. They issued 30 separate warning letters to telehealth companies. The FDA commissioner made it explicitly clear compounders cannot circumvent the rigorous FDA approval process by mass marketing compounded drugs now that the name brand commercial versions are widely available.
Wow. So they can't make a direct copy anymore, so they must be trying to tweak the formula just enough to claim it's a completely new, customized invention for the patient.
That is exactly what they're doing.
Yeah, because reading through the Venable LLP Legal Insight Report, they outline this strategy. Let's call it the B12 loophole. So they are taking the active peptide, semaglutide, and they are mixing in a little bit of vitamin B12.
It is a very clever, though legally perilous, maneuvering tactic.
Yeah.
By adding B12, which often turns the liquid a light pink color, the compounding pharmacy argues to the regulator, look, it's not a copy of the commercial drug. It has B12 in it. It provides a mild energy boost.
Oh, man.
This is a completely new, customized formulation designed for this specific patient.
So they're just sprinkling in a vitamin to dodge a massive pharmaceutical patent.
Pretty much. The FDA, however, is firmly rejecting that argument.
I would hope so.
Their April 2026 update clarifies a strict mathematical standard. Basically, if the active ingredient, the semaglutide, is within 10% of the strength of the commercial drug, and it's taken via the same route of administration, like a subcutaneous injection, the FDA still considers it an illegal copy, completely regardless of the B12 additive.
Huh.
The agency is just systematically closing these regulatory gaps to protect the integrity of the approval process.
It's a massive tug-of-war between patient demand and regulatory control.
It really is.
And this tension, I mean, it's even reaching the highest levels of federal policy now. Like, HHS Secretary Robert F. Kennedy Jr. recently suggested reclassifying about 14 of these previously restricted peptides.
Right. The proposal is to permit compounding with a prescription.
Yeah, with the stated goal of essentially moving these specific therapies into regulated formal clinical channels rather than, leaving patients to source them from unregulated online marketplaces. It's a direct reflection of this ongoing national debate over how best to manage widespread patient access while ensuring strict safety standards.
And that tension between controlling patient access and maintaining safety standards, it doesn't just stop at weight loss and diabetes.
Oh, definitely not.
No, it spills over into an entirely different, much less regulated side of the peptide market, the $1.3 trillion longevity and preventative wellness sector.
Okay, here's where it gets really interesting.
Yeah.
Because when you step away from the mainstream diabetes clinics and you walk into, say, a Beverly Hills Wellness Center, you aren't just hearing about insulin and blood sugar anymore.
Not at all.
You're hearing about cognitive optimization, reversing the biological clock, and clearing brain fog. And one of the most controversial stars of this specific space is a peptide complex called cerebrolysin.
Cerebrolysin serves as such a fascinating case study in how the longevity market operates right on the fringes of traditional medicine. Scientifically, it is a complex of low molecular weight peptides, and it is derived from the standardized enzymatic breakdown of purified porcine or pig brain proteins.
Okay, wait, I just have to pause there so we can fully appreciate this. Pig brain proteins.
Yes.
People are voluntarily injecting peptide chains derived from purified pig brains to try to optimize their own human cognition.
I mean, I know it sounds like pure science fiction, right?
It sounds crazy.
But the major biological selling point of cerebrolysin is actually its physical size. The peptides in this complex are all under 10,000 Daltons.
Okay, and just to put that in perspective for you, 1 Dalton is roughly the mass of a single hydrogen atom.
Exactly.
We are talking about molecules so unimaginably small that they can slip right through the tight microscopic netting of the blood-brain barrier.
Which is the critical hurdle for any neurological drug.
Right.
Most large therapeutic compounds just cannot get past that protective barrier to actually interact directly with your brain's neurons.
But cerebrolysin can.
Cerebrolysin can. And once it crosses that barrier, it mimics the effects of naturally occurring neurotrophic factors in your brain. Specifically, BDNF, which is brain-derived neurotrophic factor, and NGF, nerve growth factor.
And BDNF is huge because it doesn't just nourish the brain. It actually stimulates neuroplasticity. Like, it helps your neurons physically branch out, forming new synapses to transmit signals faster.
Right.
It's essentially like laying down new high-speed fiber optic cables between the servers in your brain.
That's a great visual.
But I have to push back heavily on the efficacy claims here, because reading through the source material, there's just a glaring contradiction.
The clinical data is heavily debated, to say the least.
Right. The clinic marketing material boasts that it's approved in 45 countries, mostly in Europe and Asia, and they aggressively cite this CARS trial, which showed positive outcomes for stroke rehabilitation.
True.
But it is absolutely not approved by the FDA in the United States. Furthermore, when you look at the 2023 Cochrane Review, which is widely considered the gold standard for unbiased medical evidence, they found no clear benefit for preventing death and acute ischemic stroke.
Yeah, the data there was not promising.
And they even noted a potentially higher rate of spontaneous adverse events in some patient subgroups. So how on earth do we reconcile those two realities?
You reconcile it by understanding the massive philosophical shift toward what the longevity market calls health span first medicine.
Health span first. Okay, explain that.
Well, traditional medicine, and by extension, the FDA, evaluates a drug based on its ability to treat a specific acute disease state.
Like a stroke.
Right. Did it cure the acute ischemic stroke? Did it prevent mortality? The Cochrane review suggests the evidence there is weak or mixed at best.
So it completely fails the traditional disease model test.
Exactly. But longevity clinics are using it off-label for a completely different purpose. They aren't trying to cure a stroke patient in an emergency room. They are using it proactively.
Right.
The goal of HealthSpan First Medicine is to optimize biological function rather than just treating chronological decay. So they are administering Cerebrolysin to combat brain fog, enhance neuroplasticity, and chase peak cognitive optimization in otherwise totally healthy people.
So they're trying to upgrade the machine, not just patch it up when it breaks.
That's the pitch. However, the Global Market Report explicitly warns that this wellness sector is plagued by weak clinical evidence and significant regulatory gaps.
Yeah, I'm not surprised.
Combining unproven biomarker testing with off-label animal peptides without strong clinical outcome validation, that poses real physiological risks. It's the ultimate buyer beware market.
Absolutely.
Yet, the consumer demand for optimization is so insatiable that the market just continues to grow exponentially anyway.
But listen, whether we are talking about massive pharmaceutical vats of synthetic GLP-1s for diabetes or, purified pig brain derivatives for longevity clinics, there is a fundamental physical bottleneck to this entire industry.
The manufacturing.
Yes. How do you actually manufacture a microscopic chain of amino acids at an industrial scale without the fragile chain just falling apart?
The chemistry required is incredibly complex, but the dominant manufacturing technology right now, holding a commanding 52.1% of the market share, is called solid-phase peptide synthesis, or SPPS.
And I looked deep into the mechanics of this, and honestly, the best way I can describe SPPS to you is to imagine building a microscopic Lego tower on a sticky base plate.
Okay, I like that analogy.
Right. So you have your base plate, which in chemistry is an insoluble resin. You snap on your first Lego block, which is your first amino acid.
Right.
But to get that block to stick, a bunch of extra chemical byproducts and plastic dust gets everywhere. So you have to wash away the extra pieces using specific solvents after every single block is snapped on.
Exactly.
And you snap on the next block and you wash it again. You do this sequentially, block by block, washing every single time until your specific peptide chain is complete.
And the brilliance of anchoring the chain to an insoluble resin is exactly what you described. It allows chemists to aggressively wash away the unreacted materials and protective chemical groups at every single step without washing away the actual valuable product you are building.
Because it's stuck to the base plate.
Right. This sequential process allows manufacturers to build incredibly long and complex peptide chains with remarkably high purity. I mean, without the invention of SPPS, the modern peptide industry simply wouldn't exist at this commercial scale.
So the manufacturing is locked in. It works. But even with high-purity SPPS, there is still a massive biological hurdle when it comes to getting these peptides into the human body.
Ah, the delivery method.
Yeah, because right now, parenteral delivery, which is really just the clinical term for injectables, completely dominates the market. It represents $30.8 billion of the industry.
It's massive.
So if nobody wants to take a daily needle, the holy grail here has to be a pill. But I'd imagine the harsh digestive acids in the human stomach would just absolutely shred these delicate amino acid chains before they ever hit the bloodstream.
Historically, that was the insurmountable wall. You just couldn't take a peptide as a pill because the acidic environment of the stomach and the digestive enzymes in the gut would cleave the amino acid chain to pieces.
Right.
However, the market report highlights a massive, well-funded race to develop sophisticated permeation enhancers and specialized enteric coatings.
Enteric coatings, how do those actually bypass the stomach acid?
Well, the enteric coating acts as an armor, basically protecting the delicate peptide pill from the stomach acid so it can safely reach the intestine.
Okay, but it still has to get into the blood from there.
Right, reaching the intestine isn't enough. The lining of your intestine is guarded by tight junctions, which are essentially microscopic bouncers locking arms to keep large molecules out.
Okay.
Permeation enhancers are chemicals designed to temporarily relax those tight junctions.
No way.
Yeah, they essentially trick the biological bouncers into unlocking their arms just long enough for the peptide to slip through the intestinal wall and into the portal vein.
Wow. Freeing patients from the needle entirely. I mean, if they can crack that oral delivery mechanism at scale, the adoption rates across the globe are going to absolutely skyrocket.
Oh, unquestionably.
So what does this all mean? We've covered a massive amount of ground today. Peptides clearly represent a fundamental tectonic shift in how we approach human biology in medicine.
Without a doubt.
We've moved from the undeniable, massive clinical validation of GLP-1 master switches, treating diabetes and obesity, all the way to the wild, less regulated frontier of longevity treatments, like Cerebrolysin chasing cognitive enhancement.
Right.
And caught squarely in the middle are the regulators and the FDA, scrambling to write the rules and shut down the compounding loopholes in a landscape that is evolving significantly faster than the law can keep up.
It is a remarkable, highly volatile moment in medical history. And to build on your point, there is one final, deeply provocative thought from the market report that I think frames exactly where this industry is heading next.
What's that?
Well, we spent time detailing how difficult these peptides are to sequentially manufacture, but the report heavily features the rise of AI-enabled precision medicine and AI-driven peptide discovery.
Oh, wow. So AI isn't just generating text and images anymore. It's generating biological sequences.
Exactly. AI is currently being deployed to predict complex disease risks and to digitally design brand new peptide sequences from scratch, literally testing millions of amino acid combinations in seconds.
That's insane.
So the provocative question becomes, how long until we move past mass-produced, one-size-fits-all blockbuster drugs entirely?
What do you mean?
Imagine a near future where an AI analyzes your daily biological markers pulled from your smartwatch or a morning blood prick and a desktop synthesizer sitting right on your bathroom counter. 3D prints a custom daily peptide cocktail perfectly tailored to exactly what your specific cells need that very morning.
Just a completely bespoke microscopic master key, cut fresh every single day just for the unique locks in your body.
Exactly.
That is incredible. And depending on how fast the regulators move, honestly, more than a little terrifying.
Oh, definitely.
Well, thank you for joining us on this deep dive into the world of peptide therapeutics. Keep questioning the information overload around you. Keep looking for the underlying mechanisms of how things actually work. And remember, the next time you take a medication, ask yourself, is this a sledgehammer or is it a master key?